Okay, thanks, Angela, and congratulations to our winners. Now it's time for our opening keynote. And it's my honor to welcome Annie Martin to the stage. Annie Martin is the Health Beyond Portfolio Manager at the Canadian Space Agency. She'll take us on a deep dive into the groundbreaking Health Beyond initiative, a program that's not only shaping the future of healthcare in space, but also redefining how we approach connected care on Earth. Ladies and gentlemen, please join me in welcoming Annie Martin.
Good morning, everyone. So you can hear me well? Yes? So it's truly an honor for me to be here today. So I've been at the Canadian Space Agency for almost 20 years working in space medicine. And I have to tell you that one thing that I enjoy a lot is when we see the impact that the work we're doing for astronauts, reaching Canadians and making a difference. And we're all here, sharing a vision. A vision of creating a world where healthcare is accessible, effective, and resilient, no matter the challenges we're facing. And today, I'll be talking to you about some of the groundbreaking work that we've been doing at the Canadian Space Agency, specifically on connected care, reshaping how we're thinking about healthcare for the most extreme and remote environment imaginable. But as I'll show you today, this isn't just about space. This is also about the future of healthcare here too. So together, let's explore how innovation designed for the farthest frontiers can help bridge the gap in access to care here at home as well. So it's about daring to imagine, collaborating across fields, and making tomorrow's possibilities a reality. So thank you for joining me on this journey today. So how many of you have looked up at the night sky and imagined what's beyond? That vast expanse is where the magic of exploration happens. And guess what? Canada is right there, making big waves in space innovation. Canada has been a trailblazer in space innovations for decades. In 1962, we were the third country in the world to build and launch its own satellite, Alouette 1. A groundbreaking achievement that made Canada a leader in space science. And here's another unique point of pride. The first foot on the lunar surface during the Apollo 11 mission, it was actually Canadian. The landing gear on the lunar module was designed by a Canadian company and was actually the first step on the moon. And in addition to that, we've been one of the main collaborators on the International Space Station for the past decades. We've contributed Canadarm, a great achievement for space robotics. We're also building and operating Earth observation satellite to map land and ice. And we'll be part of an historic mission coming up, Artemis 2. As the international community is going back to the moon and then getting ready for Mars, we'll have a Canadian astronaut in the Artemis 2 mission, Jeremy Hansen. So really looking forward to, being involved in those future missions. So today, Canada's space sector is stronger than ever, with more than 200 organizations, 10,000 skilled professionals, and $5.5 billion in revenues generated annually. So Canada is making substantial contribution in human spaceflight, Earth observation, planetary exploration, and space robotics. So Canada's place in space is more than a footprint. It's a legacy in the making. And we're helping humanity go further. And just not to survive in space, but to thrive. So as we continue to push the boundaries of space, Canada remains at the forefront, making breakthroughs, and ensuring that it will benefit all Canadians. So all right, so we've established that Canada has an incredible role in space innovation. So now I want you to imagine something with me. We'll take a trip to space together. So imagine yourself leaving Earth and watching it get smaller and smaller as you head toward the International Space Station. At 400 kilometers above the planet, it's a relatively short trip. Communication with Earth, almost instant. And if there's an emergency, resupply and evacuation can happen fairly quickly, which is good because there's not a lot of room on the International Space Station for a medical kit or medical equipment. And now, what if we go further? Let's go to the moon. So located at 400,000 kilometers, communications are no longer instantaneous. 2.6 seconds delay. It's not that much, but when you're dealing with high-risk operations, or if there's an medical emergency situation, every second matters. And also, you can come back quickly. So it will take a couple of days to come back from the moon. So you will want to have the right equipment to save your life if you need. And you know what? Just like the International Space Station, there won't be that lot of room either for medical equipment. So we need to plan ahead of time and be wise in the decision we will be making in terms of the equipment we're bringing. And then there's Mars. At its closest, it's 56 million kilometers away, and it can stretch to 400 million kilometers. Now you're facing 40-minute communication delays. So if you need immediate assistance, it can take up to 40 minutes or even a week because there will be blackout period during a mission to Mars. So Houston, we've got a problem. In addition to that, we're leaving the protection of the Earth when it comes to radiation. So you will be exposed to higher dose of radiation, increasing the risk of cancer. And there will be other potential medical issues associated with that. You're in a mission for approximately 3 years between launch and return to Earth. So there are a lot of issues that can arise, depending on your activities, walking on the planet, dealing with a number of equipment. And what about the spacecraft? Again, there won't be a lot of room for medical equipment. So I can reassure you that we're currently planning to ensure that we analyze the risk and the probabilities in a way that we're optimizing the space that we'll have to equip the crew with the right technologies to ensure that they are safe. So the way I said it, why would we want to go to Mars? Well, it's about exploring. I can tell you that, the astronauts that we have with the international community are excited to embark on this mission. And in the space medicine community, we'll make sure that they are going to be safe and healthy. So with the challenge I just mentioned, you may start to realize, what all of this have to do with you here. The truth is, the challenges we face in space, like isolation, delayed communication, and limited resources, mirror some of the constraints that you're facing in healthcare too, whether you work in a remote communities, you're dealing with delays in diagnostic, or you're stretched thin by resources. The obstacles are surprisingly familiar. So as we explore space, we're forced to find innovative solutions. And these solutions often translate in Earth-based application. So these lessons we're learning, as we're, traveling out there in the universe about remote care, autonomy, and survival, are more than just about surviving in space. they're about improving health and wellness here too. So now that we've taken a journey into space and felt the weight of its constraints, let's zoom in a little bit more about how we care about astronauts in space. So you see, keeping astronauts healthy in space requires a comprehensive approach and careful planning, about risk and probabilities to ensure that we can keep them safe and healthy before, during, and after their space missions. And I'll tell you a little bit more about the different key strategies that we're using to keep our astronauts healthy. First, we focus on prevention. There is a very rigorous selection process in order to become an astronaut. And healthcare is part of it. So a number of applicants are excluded based on some health risk factors or medical history. And then, once they are selected, we take proactive measures to ensure they remain healthy. So either through conditioning programs or closely monitoring their health. So we're ensuring that when astronauts are going in space, they are very healthy, minimizing the risk of developing a medical condition in space. And addressing risk early can make the difference between a good outcome and a critical situation. Next, we equipped our astronaut with basic medical skills training. So each astronaut undergo training so they can manage basic, medical interventions. They learn how to do CPR, they learn how to treat minor injuries and administer medication. All items that are key, when you don't have an hospital around the corner. On the International Space Station and in the future mission, we also have crew medical officer, or CMO, which is a physician or someone with advanced medical training. So they can handle more complex situations if they ever to occur in space. And even CMO need backup. So that's where mission control and specialists on the ground come in. Specialists, experts are on call during space missions, and we have a physician that we call flight surgeons available 24/7 to provide guidance if medical concerns may arise. Periodic medical and psychological consultations are also very frequent and crucial in space, and these help ensure that our astronauts are not only physically healthy, but also psychologically well. Space is isolating, and it can take a toll on their mental health as well. Of course, most of this is only possible on mission close to Earth, so where communication delays are minimal. And our approach to healthcare for missions to the Moon and Mars will require a paradigm shift, to bring astronauts even more autonomous, in managing their health and caring for sick or injured crew members, while ground personnel will still be there supporting, but more in a delayed fashion, providing recommendation or advising on decisions that would have been taken by the crew. In addition to prevention and training, we also equip the crew with medical resources. And I referred to it earlier, it's very limited on the International Space Station and in the future spacecraft. But we equip the crew with basic medical equipment, such as, on the International Space Station, they have the iStat, so the capabilities to do basic blood tests. They have vital sign monitoring technology like those we have in clinics, a blood pressure cuff, pulse oximeter, ECG. And we also have an ultrasound, which is the only imaging modality so far on the International Space Station. And in terms of medication, very basic medication is provided. So mainly because there are not a lot of room. So again, prevention, risk, probabilities are the item we're counting on to ensure that nothing major is happening. Because, if there's something that is unmanageable, by the crew on the International Space Station, we have the possibility to bring the crew back rapidly. So there's always a vehicle that is, on standby, ready to bring back the crew if something would happen. But this would significantly jeopardize the outcome of emissions. So hence the need to have a robust health management protocols for space. So what happens in space? So we often compare spaceflight as accelerated aging. So the crew is floating in microgravity, and it's similar to laying in bed all the time. So you can imagine bone and muscle loss, important deconditioning. And with the impact of the space environment, like the noise, the floating particulate, there's a lot of either respiratory issues that can arise. So among some of the symptoms or medical issues that astronauts are experiencing in space, we can think of, the increased risk of arrhythmia and cardiovascular problem due to deconditioning, but also to fluid shift because the gravity is no longer pulling down fluids. We also see more risk for kidney stones, because of bone loss, the calcium, going in the bloodstream combined with dehydration, increase the probabilities of having kidney stones. Skin rash, burn, decompression sickness, back and joint pain, gastrointestinal issues, and even venous thrombosis. So these are all risks that astronauts are facing in space. And as the mission will get longer, either on the lunar surface or a mission to Mars, there are more chance that some of these medical conditions will arise, and the crew will need to be able to face them, autonomously. So far, we've been able to rely on the safety net of Earth, whether it's quick communication with medical experts or the ability to return home in an emergency. But as we prepare to move beyond the International Space Station, toward the moon and onto Mars, that safety nets begin to unravel. So remember the communication delays we talked about? A trip to Mars, 40 minutes, there's no quick back and forth. So how do we support the crew in there? So we need to see a paradigm shift in how we're managing the health of the astronaut. So we're moving toward what we call an Earth-independent medical operations paradigm. And the goal is clear. Astronauts must be able to handle medical situation on their own. But how do we get there? So as we plan for those future missions, we need to design and develop more advanced technologies. So think of diagnostic tools that can work without the need for real-time guidance from an expert, or easy-to-use solution that is streaming seamlessly into a platform. Imaging technologies capable of monitoring continuously the health of a patient and have early warning in case of the onset of a medical situation, so that we can act before it gets to a level that is unmanageable. Imagine a platform that is easy to use by novice or expert. And I'm sure that as I'm saying that, you can think of a number of solutions that already exist out there at different level of maturity. So the Canadian Space Agency, with all the innovators, are not trying to reinvent the wheel, but how can we leverage the innovations that are out there in our healthcare system or developed by our innovators, so that we package it in a way that will help astronauts, travel millions of kilometers away. So what we need is connected care, just like we need here, to enable a seamless data communication, ensuring crew members can receive continuous, personalized healthcare no matter where they are. And this isn't just a luxury, for astronauts, it will be a necessity. So I mentioned decision support. So we're talking about virtual assistant, artificial intelligence, that can help astronauts make critical and informed decision making. On a mission to the moon or Mars, there will be hopefully one physician, but this physician won't be able to be an expert in everything. It's impossible. So by empowering, the crew medical officer with adequate artificial intelligence solution, expert system, that will be key in enabling more informed decision making. And we count on expert systems. So, we're hearing a lot about, black boxes, and we don't know exactly how the decisions are made. So it's important for us, as we work with our physician and our flight doc, that, the expert system are based on best practices, and that there's a team of healthcare practitioners that are backing the system, so that, the crew medical officer in space, can understand the decision that is being taken. And it's very similar to how we are addressing, AI in healthcare in on Earth. So we hope to leverage all the work that is done in Canada in AI so that we can incorporate some of that for a future system in space. And another item that we need to develop is just-in-time training. Because as I mentioned, the crew medical officer won't be an expert in everything. But just the fact that, going on a mission to Mars for 3 years with a healthy crew, nothing is likely to happen maybe the first year. So skills degradation is a reality. So how do we have tools that help healthcare, the crew medical officer or any crew member to acquire new skill or maintain existing skills? And imagine if you're one of the crew member and you find your crew medical officer unconscious in his or her quarter, you want to have the right tools in order to learn how to save his or her life. And last thing I want to say about that is that technology is only one part of the story. We'll need to train the crew to be more autonomous, not just technically or related to medical skills, but in decision making under pressure, in stress management, and in team-based problem solving. So they'll need to trust their training, their tools to keep themselves and their crew member alive. So this transition to deep space means that we're moving from a model of Earth-dependent operations. So the crew currently on the International Space Station is highly dependent on what people in mission control are telling them to do, to one of through Earth independence. So there's lots of change management stuff here that we'll need to do. But the further we go, the more we'll need to trust in our own abilities, our technologies, and our resilience. And while this is a huge challenge, it's also an incredible opportunity. The breakthroughs that will redefine both space and potentially terrestrial healthcare as well. So the innovations that we need for astronauts, to thrive millions of kilometers away from home could transform healthcare here, making it smarter, more adaptable, and ultimately more accessible to everyone. So how do we get there? So how do we turn that vision of Earth-independent medical operation into a reality? At the Canadian Space Agency, the answer is through the innovation we're making in Connected Care Medical Module, or what we call C2M2. So C2M2 is at the heart of the Health Beyond initiative that I proudly lead. And Health Beyond was created in 2019 when Canada decided to join NASA on the Artemis program, going back to the moon and on to Mars. And our team is there to identify potential Canadian contribution. So what can Canada contribute for the Artemis program? Well, one possibility is contribute healthcare technologies and medical services to the international community. So in order, to imagine that Canadian contribution, we came up with the C2M2, which is a framework and the vision for that medical care system for the moon and Mars. So what is it? It's an advanced, portable medical system. And it builds on Canadian innovation. So all the new technology, the advanced technologies I mentioned about, a lot of them, like I said, already exist at different maturity levels. So what we're trying to do is with Canadian innovators, companies and researchers to bring together all those medical devices, power it with AI and just-in-time training solutions so that we have a portable system that will deliver healthcare to astronauts in deep space missions. And we're getting there faster than you may think, because a lot of those technology exists. How can we make sure that this happens? So we have an approach that is one of rapid prototyping. So, we're going the SpaceX way. We try to have our innovators, innovate, and those innovation, then we include, feedback loop, and we're trying to learn as fast as we can. So it's a combination with radical innovation, with the new perspective that we're trying to bring with our connected care medical module, but it's with also incremental innovation so that these increments, can then, go back in the real life and then make benefits to Canadian in the healthcare system. So we're doing those innovation in really rapid cycle. So C2M2 is not just a piece of equipment. So it's an integrated system, of medical devices, decision support, and virtual care capabilities. And what you see in this picture are from the first round of technology development that we did in 2022 and 2023. So you can see, on the right-hand side, only 2, and we had 5 prototypes being developed by innovators. And we asked our innovators to develop a medical system in a 40-feet shipping container, which looked like a little bit of a lunar module, but it's also a portable, transportable type of medical system that could go anywhere. On the right-hand side, what you see is the interior of 2 of those C2M2. And we use them to demonstrate, to look into the features, because in round 1, what we asked innovators was like, show us what you got. We invested $10 million in those prototypes, and it was like, bring innovation together and show us what we can dream of. And I can tell you, it just not only blew us away, but our international partners were very impressed by the solution that our innovators put together. So in 2024, we were ready for round 2. So in June, we published a request for proposal for the round 2 of our connected care medical module. And in September, we awarded 4 contracts for the design phase of the round 2 of C2M2. And what we were asking innovators was, okay, so we saw what's in the realm of the possibilities. Now we need to package it in an even more portable way. We need to address specific medical use cases, and we focused on routine triage-like type and medical exam. So with a list of specific medical devices that we need, and we asked them also to prepare 2 emergency use cases, so to have everything that is needed to deal with different type of medical emergency. So this is ongoing. We will soon announce which of the 3 of our 4 current contractors will move to the prototyping phase, and they will need to deliver their C2M2, this time not in a shipping container. I can tell you that we cannot take any more shipping container at the CSA, but the important is what's inside. And they will deliver it to us by March 2025. So it's really rapid, but again, it's to learn. And one important aspect is that when we look at our round 1, it's not just sitting, at the CSA. Some of the subsystem, or even, big part of the system are currently, will be deployed, in real life settings so that we can really assess how these new improvement can really make a difference. So there's an EMR, a subcontractor of one of our contractors, that will deploy in indigenous communities by the end of this fiscal year. There is one of our C2M2 system that will be deployed in the Montreal healthcare setting to look at, wellness of citizens. And we're looking at one of our C2M2 also to be deployed, with paramedics, in disaster relief effort type of setting. And the reason is that, when our collaborators have been looking at those systems, they identify which aspect of them could really make a difference. And that's where we want to emphasize some of the work we're doing. So what is the intersection between what we need for astronauts and what different groups and organizations need here, so that at this intersection we can develop meaningful collaboration so that we can start making a difference. The mandate of the Canadian Space Agency is the health of astronauts. So we do not have a mandate for delivering care to Canadians. But as part of our mandate is to ensure that the funding and the investment that we're making have benefits to Canadians. And that's how that we identify our way to ensure benefits, is to work with the organization and ensure that how can we translate the innovations that we need for space into something that can be impactful here on Earth. So our C2M2, are part of, the future generation of connected care. And if you allow me just for a moment, with your imagination, to imagine stepping in one of those C2M2, how would that work? So if you enter in one of a C2M2, so let's imagine you're an astronaut on the surface of Mars. It's 2045. You've been, you left home a year ago, and you wake up. So you wake up in your quarter, and you're not feeling so good. So you fill your daily questionnaire. You either type in or talk to your virtual assistant, pending your preference. And because we need to empower crew members and make them, more resilient, this information stays with the astronaut. We're not, oversharing information. It's not because you're an astronaut that suddenly all your data become available to everyone. You're still a patient and you own your data. So, but that morning, we ensure that we make our astronaut conscious of the impact of disclosing, medical problems. So that day, the virtual assistant, he's not telling you to do some exercise or to do some mindfulness, exercise. It's telling you to go and meet the crew medical officer. So an alert is sent to the crew medical officer that, you're going to come and visit. So you enter in the medical bay, and it could look like the top right image. You enter in the medical bay, and the crew medical officer is there waiting for you. So, through a conversation, just like if you're in, your family physician office, you'll describe your symptoms, and the crew medical officer, will be supported by a virtual assistant, thanks to speech-to-text recognition. We'll pick up some of the word and will help guide the conversation to really try to understand. And the system, also have access to all your data because everything is in one location. So in order to augment, the understanding of the situation, you have some vital signs devices, put onto you. If we're there with the technology, it could be a camera that detects your vital signs. And we talked Star Trek, before. I don't know if you've seen the movie Passenger, but there's kind of a thing that you get in, it scans and it fixes you. Well, we're not there yet. I can tell you we're not going there yet. So you'll just have, medical devices, hooked to you to update, your vital signs, and that data get analyzed, and there's an expert system that will kind of pull whatever it is, and you trust your crew medical officer. It may make some call if it's not too urgent, and it's abdominal pain, so need an ultrasound. We have ultrasound in space, and it's one of the imaging modality that we use. So has your CMO done, ultrasound for the past 6 months? Maybe not. Put on is augmented reality goggle videos to help. So with that just-in-time training, we're trying to empower the crew medical officer to take the image. It's hard to be an expert in everything, and like I told you earlier, people on the ground in mission control will still be there supporting, and they will still play a key role. So we're not trying to replace the physician on the ground, but they'll receive the images, the data, and they will be able to provide recommendation, question the decision that was made by the crew medical officer and the virtual assistant, and then continue to guide the crew in managing the health on site. So that's what our C2M2 does, integrating all that, building on the medical history, all the data of the astronaut, and trying to make sense of what's happening and guide, resolution of the medical issue. And one thing that flight surgeon is scared about, I talked about medical abdominal pain, appendicitis. It's unpredictable, and it can happen in space. And it's a nightmare for flight surgeon. And some people are saying like, well, just remove the appendicitis, the appendix, But then, the adherence caused by the surgery can bring other problems. So, so often, there's situations that we don't know yet what we're going to do with that. But I can tell you that, appendicitis is a nightmare. So C2M2 is key for the CSA in determining what will be that future system. So we're really trying to do what has not been done in space. There's no clear recipe of, what exactly we need, what's the user interface, what does it mean when we say that it has to be easy to use, what's easy to use, what are the standards? So, so it's with our rapid prototyping and rapid cycle that we hope to identify more rapidly what exactly we need. And it's counting on healthcare practitioners here on Earth that will be advising us on how the technology should be, that will be enabled to really develop, a system for space and a major contribution for Canada, but also connect with the right organization here in Canada so that, these innovations can reach Canadians. We fully understand, as well, that adoption of technologies is a major challenge, that our healthcare system is complex with the jurisdiction. So the Canadian Space Agency, is remaining, in our territory, meaning that, we're looking at space, but we're hoping to build bridges, with your organization so that we can identify what are those standards, what are those requirements so that we can develop meaningful solution. So C2M2 has the potential to be a game changer, not only for the future of space exploration, but how we approach healthcare access here. So by bridging the gap between immediate care and the vast distances, C2M2 and the related innovation can bring us closer to a world where no one is out of reach of quality medical health care. So now you might have a good understanding of, what space healthcare innovation have to do with us here. And the answer lies in the unique synergies between the challenges faced in space and those faced by medically isolated population. So we're working currently with, indigenous organization, remote healthcare organization, disaster relief effort, paramedic, the defense, when we think of deployment in war zone, because all of these organizations or groups are facing issues that we're also trying to address. And we also take into consideration, urban center, with aging population. You can be in an urban center in a big city and still feel isolated from your home healthcare. So the innovation that we're developing are trying to address those specific synergies. Limited access to emergency evacuation, and I should say expensive as well. Limited number of healthcare practitioners, delayed communication, and limited resources. So it's about leveraging our work, for deep space missions to make meaningful differences here on Earth. So in the end, it's a two-way street. Space may push us to innovate, but those innovations can come back home, making healthcare more advanced, more accessible, and more efficient for everyone. But it requires collaboration to get there. So as we look to the future, it's clear that the journey doesn't end here. The innovations that we're developing for space are just a beginning. And with our collaborators and our innovators, we hope to lay the foundation for a connected care system, and not only for space explorers, but also for a new era in healthcare. And none of this happened in isolation. It requires collaboration between agencies, industries, governments, and nations to turn daring dreams into reality. The challenges of space compel us to innovate, to push beyond what we thought was imaginable. But it's through collaboration that we bring those innovations home, sharing benefits with all Canadians. And that's where all of you come in, whether you're a healthcare practitioner, an innovator, an advocate, a patient, a policymaker, or a future astronaut yourself. Each of you play a part in this story. So together, we're not just exploring space. We're building a future that's more connected, more inclusive, and more resilient. The futures belong to those who dare to dream. And this is a future we can build together. So let's keep dreaming. Let's keep pushing the boundaries of innovation, and let's keep reaching for the star. Because, in the space industry, we know that when we dream big and work together, there's no limits to what we can achieve. So thank you very much for being here with me today. And please don't hesitate to reach out if you want to learn more or continue the conversation. Thank you very much.